New York City hitting record COVID infection numbers not even seen in March of 2020, and it couldn't be coming at a worse time.
Yeah, with the holidays later this week, health officials are concerned about infection rates growing exponentially with families and friends gathering for the holidays. The situation also made worse by a shortage of COVID testing.
Joining us right now, New York City Health Commissioner Dr. Chokshi. Nice to have you back on Good Day. How are you feeling?
I'm doing all right. I hope you both are as well.
Thank you. So, Dr. Chokshi, we're hearing this morning President Biden is expected to bring some money to our area to set up some more testing sites. Did you ask for that, and do you know where they are going?
Yes, this is good news. New York City has one of the most vast testing apparatuses in the entire country and in the entire world. We're doing a huge amount of testing per capita. But what we've seen in recent days is unprecedented demand. So this is good support from our federal partners. We did request it. We're particularly looking for the rapid at-home test kits, which we know will really help to increase our capacity.
So let me ask you, do you know exactly where these test sites will be? Because we're getting some tweets from some of our listeners on Staten Island who claim there are not enough. There's only one testing site on Staten Island.
That's always good to know. We strive to put testing sites where we know there's demand and also to do it in a way that is equitable. So we are coordinating with our federal partners on where they'll be placed.
And speaking about those at-home tests, because, I mean, if you're feeling unwell, would you not rather just stay home instead of getting in a cab, getting on the subway, waiting in line around other people to try to get a test? So if you're trying to get those at-home tests, we've seen them double in price. In some places, you can't even buy them. Does the city have anything to do with that in terms of price controlling? Because if your water goes up during a hurricane, that's like unlawful.
Yeah, well, there are two important points that I want to make here. The first one is just to emphasize what you said. If you are not feeling well, that means even if you have mild symptoms like a scratchy throat or a runny nose, please stay home except for getting essential medical care, which does include testing. But then the second point is to yours, which is that the at-home testing kits will help with this. We know that there is not enough supply at this moment, but we're taking steps to redress that. We've already distributed 500,000 across the city, starting in the last 2 to 3 days, and we expect to get more supply in the coming days, and we'll push that out through our channels, which is our own testing sites, so that people can bring them home. Some of our other health centers, including our community health centers, as well as community-based organizations.
And maybe to speak to some of the price gouging going on, does the mayor have any control over that? Has the governor I know the governor has talked about it and has gotten some complaints about it, but what is your message to some of these stores that are doubling the price in some of these at-home testing kits?
Well, my message is that we're in a public health crisis. We're in a pandemic, and we have been over the last several months. We all need to band together, to support one another right now. So price gouging is certainly not a practice that, that I would endorse right now. In New York City, as a government, we are taking steps to ensure that we're able to provide tests for free to the population of the city.
So, Doctor, can you give us an idea on the symptoms of the omnivirus? Because some doctors are calling it the omni-cold.
Yes, so a couple of important things to unpack here. First is the severity of disease associated with Omicron. The science isn't yet settled on this, but the indications that we have from South Africa and the UK and elsewhere indicates that it may be milder illness, particularly if you already have immunity, for example, from vaccination. That's why it's so important to get vaccinated, get your booster dose if you haven't already. In terms of the symptoms themselves, in general, we see that they are relatively similar, maybe a little bit more in terms of what we call upper respiratory symptoms. That means a runny nose, a sore throat, things like that, rather than affecting the lungs and other parts of the body.
Well, that's good that it doesn't affect the lungs. What do hospitalizations look like right now in our city?
Hospitalizations remain at a relatively lower levels, certainly compared to that increase in cases, which has been sharp over recent days. We do know, however, that hospitalizations lag cases, and we are seeing them increase. I do expect that both cases and hospitalizations will continue to increase in the coming days due to Omicron. That's why we're taking this very, very seriously. And we've elaborated a lot of advice, which starts with getting vaccinated, getting boosted, and also taking other steps to protect yourself, like wearing a high quality mask, getting tested. And for people who are at higher risk, I do counsel to avoid optional activities, at least for the next few weeks.
Do you notice that people who get the omnivirus are getting over it quicker? Friends of mine have gotten it. They said they felt badly for 2 days and then they felt better. Should they get tested right away? How is it different than what we dealt with last year?
Well, first, yes, they should get tested right away. Even if you have mild symptoms, that's important because it tells you to isolate. It helps to break the chain of transmission. We have to remember that Omicron is coming to New York City when we have achieved relatively high levels of vaccination. Over 71% of our entire population is fully vaccinated, and over 90% of adults have at least one dose of the vaccine. So that is helping to mitigate the worst effects of the virus. What we're seeing is that Omicron is more likely to cause infection, including reinfections, but vaccination thus far is holding up against severe disease. And a booster dose will give you one more layer of protection against the worst outcomes. These are the things that, as a doctor, I want to protect people from: needing oxygen, needing a hospital bed, needing a ventilator.
Thank you so much, Dr. Chokshi. We really appreciate all your help this morning.
Happy holidays. Stay safe. All right.